This is Dr. Michael Brisman, neurosurgeon from Long Island, talking to you about the pituitary gland and pituitary tumors. So this is just showing the anatomy of the pituitary gland. This is at the bottom of the part of the brain called the hypothalamus that sits under the thalamus, and then attached to that is the pituitary stalk, which connects to the pituitary gland. There's an anterior front part of the pituitary gland, the anterior lobe, and the posterior part of the gland, the posterior lobe. Those sit in a bony dip of the skull called the sella, which sits behind the sphenoid sinus here, which is an air space in the back of the nose. The anterior lobe produces hormones that are released by hormones from the hypothalamus. The posterior lobe that does not produce any hormones. The hormones are created in the hypothalamus that are stored in the posterior lobe that then get released when there are certain synaptic signals from the hypothalamus. The anterior lobe produces various hormones that include adrenocorticotropic hormone that stimulates the adrenal glands to produce cortisol, thyroid stimulating hormone that stimulates the thyroid glands to produce thyroid hormones, follicle stimulating hormone and luteinizing hormone that are important in fertility, growth hormone that's important for growth, prolactin that's important for lactation. And the posterior lobe of the pituitary gland produces antidiuretic hormone that's important in water resorption, so there isn't too much water produced by the kidneys, and oxytocin that's important for labor contractions. This is a face-on view of the pituitary gland, and this is an example of a small tumor or small adenoma within the gland. This is the stalk, and this is the optic chiasm. And this is the sphenoid sinus. So sometimes, if there's a tumor that grows upward, it can cause compression on the optic chiasm and cause vision problems. If the tumor should grow off to the sides into this area, which is called the cavernous sinus, then in the cavernous sinus, you have, in addition to the carotid artery and various veins, you have several cranial nerves, including the third, fourth, the first and second division, the fifth nerve, and the sixth nerve. The third, fourth, and fifth are involved in eye movement, and the first and second division of the fifth nerve are involved in sensation, the forehead and eye and cheek areas. Those are most likely to be affected in an apoplexy event. So if there's a sudden swelling of a pituitary tumor through a stroke or a bleed, and it suddenly compresses into the cavernous sinus, one may notice some of those nerves affected, so there may be difficulty moving the eye. And in the event that these tumors need to be removed, we usually come through an endonasal endoscopic approach through the nose, through the sphenoid sinus, transsphenoidal, and then we can get through a long scope right to the tumor, and we can remove the tumor with long, slender instruments through a pretty non-invasive approach. The surgery is done under general anesthesia, takes about an hour, and patients usually go home the next day. Thank you.